Hey everyone, I just wanted to do a quick video just on some oxalate dumping symptoms, purely because anybody obviously that wants to start out on this diet or is doing the diet, is just to make them aware really of how wide a range of symptoms that could come up. Generally speaking, if you've had injuries, ailments, illnesses before, it's possible that they may resurface in some shape or form. Now, obviously that doesn't mean to the extent that you had them before, but it will just be that you've got aches in the joints or the muscles where you've had an injury, or the symptoms that you had related to those conditions might just come back. And that's generally normal because where the oxalates have done the damage in the body and they're starting to be released, it's just really coming back into the blood system and coming out. But it will be done gradually, because depending on how long you've had the oxalates there, how bad your symptoms and conditions were, will really determine how long it will take for them to come out. Some people it could be weeks, some people it could be months, and some people it could be years. It really differs depending on the individual. So just bear that in mind. Although I'll give you a list now, it doesn't mean that you're going to get all of these. It purely is just a guide that you might get one or two of these. You might get even things that are not on this list. But it's to give an idea of what other people really have experienced when doing oxalate dumping. And, again, some people might find that certain symptoms go quicker than others, so that you might heal certain parts of the body before you heal others, depending on how long they've been there. So it's just to make you aware of those things. So I'll just go through a brief list. It's really, as I say, it varies. You might find that you get quite a few on here. You might find that you get very few. So just bear that in mind. And again, if you're getting certain symptoms, it doesn't mean it's necessarily oxalate related. So please do also, if you're not sure about something, seek medical advice. That's always best practice. Or if you have somebody working with you, a nutritionist, or somebody that's certainly got knowledge of oxalates. But generally, you know your own body, and obviously take responsibility for your own health. Look into things, research things where possible. Okay, so I'll just start with the list now. Now, the first one really is just to bear in mind, there's a lot of kind of emotional, mental health related, mood swings, depression, brain fog, lethargy, maybe sudden anger or outbursts. Now, I'm giving you an example like depression. They all kind of come under more or less the same thing, where they affect your emotions or your mood. And obviously with a lot of health problems, that kind of comes hand in hand, depending on how severe they are. So it is part of the physical health, and although it kind of comes under more sort of the mental health side, it is very much connected. And just be aware that you may experience some degree of that on some level. It doesn't mean that you will get it all the time. You might just get it once every now and again. For example, when I come off two extremely high foods too quickly, literally overnight, I experienced feeling very out of sorts and quite snappy, which was not like me and is not like me. I'm certainly not someone to snap back at someone, or so that kind of took me back, because that was literally the next day. So just bear in mind that it can bring up things like that, and just be kind to yourself. And if you need a break, just drink plenty of water. Water's always good for clearing the system, for detoxing and clearing out some of these experiences and symptoms. There are other methods as well. You could have a detox bath, certainly an Epsom salts bath, and also with bicarbonate of soda. things like that in the bath, really good for helping to get things out of your body quicker. That's including the emotions as well as the physical. Okay, I will share a separate video just to make you aware of some good sort of supplements, and again, you'll do your own research, but just little tips really of which ones would be good on an oxalate diet that you could look into. Okay, going back to the list. So anything really on the mental health side, you might get a flare up, lethargy, fatigue, things like that. You can have aches and pains coming out in the body, which could be old injuries or wounds from joints, or just where you had an injury, or even just head pains, headaches. If you suffered from seizures previously, things like that, that might resurface. Again, it might not necessarily be to, a really bad degree that you've experienced, but it just making you aware that where you've suffered with things before, that those things may resurface. It doesn't mean if you've not suffered with them before, you might still get the odd thing coming out. I mean, I had a sty come out on my eye, and I've never had a sty in my whole life, so that was a bit odd. So just to make you aware, some things can just come out that you're not aware of, that you've had before. So this is why I'm just giving you a generalised list. So hormonal issues, that's a big one, particularly for women, but also men as well. But more so, a lot of women experience like a constant menstrual cycle, or disturbances in their menstrual cycle. Some will maybe just stop altogether for a while. And this is, again, all to do with the oxalate dumping. You might experience like a constant cycle where you get spotting in between. It's not heavy or anything, it's just spotting. And then you might get bursts of heavy, or it's just all over the place. But again, just know that that is one of the symptoms for oxalate dumping as well. And sleep issues, sleep disturbance, insomnia. Again, I can vouch for the insomnia. My insomnia got worse initially, and it would go, because I dropped two very high oxalate foods, as I mentioned, I literally the next night, I had, chronic insomnia, as in no sleep, even though I was taking stuff which was giving me about 3 hours at the time. And that lasted 4 nights, nothing. And I just had to meditate during the day and use other skills to try and get through that. Unfortunately, I wasn't working, so. But then it would go a few days, and then I would have poor sleep again, to a slightly lesser degree. And it just kept sort of doing that every few days, and then it would get less and less. So again, everybody's different. So just be aware of that. You may experience things like swollen breasts, breast calcifications. You may experience things like asthma, some breathing problems, or say coughing, anything to do with the lungs. Your breathing may kind of go more shallow. You may have more circulatory problems. I've naturally got circulation issues. So for me, I'm going through a period now where my feet are just going cold again. And because I was kind of born with that, it was, I inherited that. So that I'll get waves of things like that. So it's just making you aware of that. Sinus issues, being bunged up, phlegmy, bloated stomach, irritable bowel symptom. You might find that you have constipation or diarrhea or alternating, problems going to the loo. You may get some stomach pain, nausea, things like that, cramps. You may have tinnitus. If you suffer with that, that might again come back or get a bit worse initially. If you suffer with dizziness, or you may even get a bit of vertigo or things like that. Fluctuations in your hearing, your eyes might get a bit worse. I've noticed mine have recently, and I don't wear glasses, but mine have slowly been getting worse over time. And I've noticed the last week it's been quite hard. It's like it's really hard to see things that I could see 2 weeks ago. So again, just be mindful that could be, again, oxalate dumping, because it's just, again, working on those areas throughout the whole body, so it can come out in any which way. When you're eliminating stools, they could be slightly different colours. Just to make you aware, you might have black specks, white specks, crystals in the stool. There might be a sandy colour. These are all signs, again, of oxalate dumping. It might be a burning stool coming out, uncomfortable. Again, all signs of possible oxalate dumping. Again, with the bladder area, that whole area, cystitis, if you've had any cysts or anything like that, or polyps or anything again that might want to resurface briefly, UTIs. You may find that you want to go to the loo quite frequently, urination. There may be more inflammation in the body, because with oxalates they do cause inflammation. So as you're releasing them, and this is why it's good to get them out of your system quickly and as regularly, because drinking water will help with frequency in urination, but it will also help with pushing some of the oxalates out. You may find you get rashes on your skin, on your body, that maybe you think, oh, well, where's that come from? And then it just disappears within a couple of days. You might just get even a bit of red colour or hives or, pimples, spots, things like that. You may get even like a gristly type crystal coming out of the skin. And some people might have had them sort of that way for years. It's like a little bit of gristle and you can feel it. And I actually had one on my eyelid that came out last December, and it just looked like a little bit of a very tiny patch of eczema, but it wasn't. And there's just a little rough bit there. And ironically, a few days ago, it just disappeared, and it's been there since last December. So again, that to me, it hasn't come back. So that is hopeful that that's one of the things kind of reducing and disappearing in the body. Also, my sleep is slightly improving, which I'll share another time because that's a bit more in depth. You could have, again, I mentioned eye earlier, you could even have, like, if you've got cataract issues or underlying cataract issues, that might come out, eye pain, floaters in the eyes, styes, which I mentioned earlier, or just even like the crusty eyes, things like that. It's all oxalates coming out the body. You may have gallbladder issues if you've had those before, or even gallstones. You might get some discomfort there, or kidneys, around the kidney areas. Some people have actually released kidney stones through doing these diets, so be aware of that, because that can be uncomfortable. Heart palpitations, that's another one. I've had quite a few of those. And anything to do with the heart, again, circulation. You could have even liver pain, discomfort. Some people have that, liver stones. Some people that have suffered maybe from candida or fungal infections, they may have a release of that from the body. And again, maybe a review, a visit of some of those symptoms. You may get chills, cold skin, cravings, because with oxalate foods, the body can crave. Again, it could be the parasite connection, we're not sure, but it does crave higher oxalate foods. So you might find that you going on a lower oxalate diet, you suddenly start craving some of those higher oxalate foods. But again, it's just part of the process. Flu-like symptoms, which again, could tie into sort of detox symptoms, things like that. Just feeling kind of tired and, not much energy. Hiccuping, even sneezing, things like that. A bit of internal trembling, shaking. So again, that goes under chills, really. First, now that is a big one. Now I had dehydration when I was in the army many years ago, and I collapsed, and I just remember everything was luminous, and I came to in the med centre, and I was just had loads of water being chucked down my throat, and it was not a pleasant experience, I can assure you. But if anyone has experienced dehydration, then you will have oxalates for sure, because they thrive in an environment without much water, and that's why water is really good, because it helps to flush them out. So if, in my personal experience, I am thirsty all the time. I cannot get enough water down my neck, and I know that is definitely been heightened since going on this lower oxalate diet. So just make you aware of that. You might gain weight, you might even lose weight, again because of that hormonal thing going on and the balancing. You may have mouth issues like ulcers, things, difficulty swallowing. Maybe even it might affect your voice on some level. So you may have a hoarse voice, sore throat, tonsil issues, difficulty swallowing. It can come out in so many different ways, and this is why I'm sharing this. You could have, even, I know I talked about muscles area and muscle twitching, and a form of neuropathy, with nerve pain, things like that. I tend to get that more around my one of my hands, where I used to do sports massage, and I just overdid it over the years, and I just get nerve pains now, and sometimes in the arm as well. So just where numbness, things like that. So be aware of that. You may get, again, aches all over, back, neck pain. Some people have experienced burning feet, frozen shoulders, osteoporosis, bruising. So if you bruise easily, I always used to bruise easily, that you might find that you, again, bruise easily. And that your blood thins a bit, or that you, again, because it's all changes in the body. Cold sores, you may experience those. You could even have a dandruff, psoriasis flare, again for some people, acne. I mentioned rashes earlier. You could, any type of rash, they all vary really, from dry skin to, oily skin, to saggy skin, wrinkles, things like that. I know I'm not painting a very good picture here, but I'm just making you aware of all these different things that can come out. If you've got veins, prominent veins, they might, or varicose veins, they might come out again, be a bit more prominent. Teeth, some people, which is very rare, can experience looser teeth. Tartar, inflamed gums. Again, just things coming up. The thyroid area, even maybe, swollen thyroid. So just, this list, as I say, is not a definitive. It's not for everybody. You will probably have a few things on there. I've certainly got a few things on there, and I'm sort of early in the stages of doing this. It's manageable for me because I'm at a place now where I'm kind of happy where I'm at, doing the low to moderate. If I reduce it more and just stay on a low, then yes, I will probably get some more symptoms coming up. But for the moment, I'm happy where I'm at. I'm managing the symptoms. Yes, I'm seeing things changing still. So that's where I'm staying at the moment. So just bear that in mind. It's in some level, it's kind of like, oh my gosh, what's going on? Where's that come from? But in the same breath, it's quite refreshing, because then things are going on, and things are changing, and having that list will just give you a guide how much variety there is, and how many things can go, you can experience in the body. I mean, you could have hair loss even, things like that temporarily. In fact, one of the things they do suggest, which I will put in my supplements video, is that if you are experiencing a bit of hair loss initially, you can take a biotin supplement, which will just help with that, and zinc, things like that. But again, seek medical advice or professional advice. So I think that's about it. Don't worry if you are experiencing something and it's not on that list, because that is very likely. There are so many different things that people experience and have had in their own life that might not be on that list. That you might still experience. So please bear that in mind. Okay, I'm going to stop now because this is going to be a short video, and I will share one soon, as I say, with a supplement top tips. Okay, I hope this has been helpful, and on a lighter note, things get easier as you go on. So hope that helps. All right, take care everyone. Bye.